I'm Dr. Solomon, a board-certified plastic surgeon specializing in three-dimensional sculpted tummy tucks. What should a good tummy tuck look like? To answer that question, one needs to know the features of an attractive abdomen. As plastic surgeons, our goal is to always restore body parts to the way they look like in youth, before pregnancy and aging distorted them. A youthful and attractive abdomen has a flat contour when viewed from the side because the rectus muscles have good tone. There are variations from person to person, but typically the outline of the rectus muscles are visible. There is a vertical central depression between the inner edges of the rectus muscles, starting just above the belly button and going up to the lower portion of the sternum. This vertical strip does not exist below the level of the belly button. A mild fullness around and below the belly button is always there because this area has a little more fat. There is no excess skin around the belly button. It is well-defined, vertical, and centered. There is a slight depression just below the rib cage as it transitions from chest to abdomen. The fat pad in the pubic area blends into the lower abdomen without being too prominent. In other words, an attractive abdomen is a three-dimensional structure with highlights and valleys. Every woman is different, and all these features may not be present in every given person. But these are general guidelines I look to achieve when performing a tummy tuck. The next question is, what are the limitations of a traditional tummy tuck the way it's performed by most surgeons? Typically, a low incision is made from hip to hip, and the entire skin and fat is lifted off the abdominal muscle all the way to the lower ribs. This significantly decreases the blood flow to the skin, but is still adequate to keep it alive. However, if liposuction is added, there is a good chance that skin blood flow is further compromised, resulting in dead skin and major complications. Although the after results look better than the before, it does not look natural and is one-dimensional and flat without any contours. The only way to get the three-dimensional contours that I described earlier is to liposuction first before proceeding with the tummy tuck. The liposuction sculpts the abdomen to give a three-dimensional appearance, and the tummy tuck tightens the muscle and removes excess skin. I use a very different technique that preserves most of the blood flow to the skin. This allows me to liposuction freely without any limitations and create the three-dimensional contours. You will notice this in my before and after photographs. The other telltale sign of a tummy tuck is a prominent scar around the belly button. Once a tummy tuck is performed this way, it is very hard to revise it. You will notice in my after photos that the belly button looks natural.